All right, hi everyone. Well, we're gonna go ahead and start now. I'm sure a few more people are gonna continue to trickle in. If there's a spot open next to you when they come in, maybe just be like, "There's a spot," like we're on an airplane. Sorry. Welcome to the first general meeting of the Pre-Physical Therapy Club. I'm assuming by raise of hands, how many of us are kin majors? Keep it up for exercise science. Oh yeah, us too. Anybody who's not a kin major, like bio, health science, anything like that, or are we all kin? Awesome. Perfect.
Yes,
Okay. Well, all of those majors really apply to physical therapy, so no worries, you guys are all in the right spot. We'll just get started. My name is Lily. I'm one of the co-presidents here. I am a senior here at Long Beach.
Oh, there we go.
Well, it's gonna be a little out of order, guys. Anyway, I'm Lily. I'm a senior. I'm one of the co-presidents, and yeah, I'm a kin major, exercise science, and I will be applying next cycle. So I'm not in it quite yet, like Lindsay here, but I will be very soon.
Yeah. So yeah, just to go over this really quick for our meeting today, we're going to be doing board introductions. We got our first president here that we got introduced, and then we will talk about our goals and our purpose for this club. Hopefully you guys want to get out of it, what we'll be able to provide to you. Then we'll go into different specialties and different areas of focus that are in physical therapy that you can possibly look into now or in the future, and then what to expect next for our club. So let's meet the board a little bit that we have. So hi, everyone. I'm Lindsay. I am the other co-president to Lily. I am in my last semester right now at Long Beach, of course, and I am technically, I guess, a fifth year. I'm a fourth year plus one semester. So as Lily mentioned, I am in the process of applying to schools right now. I literally just have to press the submit button. I'm just like holding on. I'm getting my essays and stuff graded and all of that. So, or not graded, but reviewed. But yeah, so if you have any more specific questions on the PT application process, if any of you guys are in it right now, feel free to let me know because I am in the thick of it. So just let me know. But yeah.
Okay. And then our vice president is Tanzi. She is unavailable for this meeting, but I'm sure you guys will see her later in the semester. I believe she's also a fourth year exercise science major. I think she's applying next cycle with me. So yeah, I'm sure you guys will see her soon. We'll give her a better introduction then.
My name is Peyton. I'm a third year. I'm the secretary for this club. So I'm not applying to any PT schools yet. I still have another year. So yeah, majors kinesiology, exercise science, like all of us. So
Awesome. So same thing with Claire. She is our treasurer. She is unavailable today. I think she's working, but again, hopefully we'll be able to meet her as well in the short times coming.
I'm Marine. I'm a third year kin exercise science major. I'm getting a minor in biology. I'm the publicist, so I make the Instagram posts. So if you like the post, that was me. And if you got a DM, that was also probably me.
Awesome. And then last but not least, we have Alvin. I believe he should be coming shortly. He's our community outreach. So I think a lot of the, if anyone has been receiving emails, it's been me up to this point, but from near or here on out, it'll be Alvin who's communicating with you guys. Alrighty, so our club's goals. So the main purpose of this club, if you guys came to Week of Welcome, you kind of already got this spiel, but we are your guys' resource. Any kind of information that you want about the field of physical therapy, whether it's about the field itself, if it's about the application process, the specialties, anything about that, we have all of the information for you. And if we don't, then we know people who do. So we absolutely will be hooking it up with all kinds of resources and workshops for us to become the best PT applicants possible. We're going to talk about what it's like to be a student in the physical therapy program. We're going to have Q&A sessions with active DPT students as well as active DPTs. So I've kind of already mentioned this. We're going to try to become the best applicants we can. We're going to talk about what schools are looking for specifically, what prereqs are required, what requirements are needed under your application, what looks good, what looks better, all of those kinds of things. We have all that information. And then obviously we have a lot of people in here today, so I'm so glad to see that. We are an informational club, but we would love to be social as well. So this is a great opportunity. If you guys don't know each other already, I'm sure you've seen familiar faces in classes, but you guys clearly all have the similar career choices. So it would be good for you guys to know each other now, connect, and be able to build upon these networks, because it really is about who you know and not necessarily what you know.
100%. Okay, so you're all in here. I'm sure you've heard a little bit what a physical therapist is. I'm sure if you were an athlete or if you had some injury, you've been to a PT clinic. But what is a PT for those of you who have no idea? So using the definition from the APTA, physical therapy is treatment provided by a physical therapist or physical therapist assistant that helps people improve their movement and physical function, manage pain and other chronic conditions, and recover from and prevent injury and chronic disease. So that is a large definition. Physical therapists do a lot of things, but essentially they help people treat and manage their pain. As a physical therapist, well, as future physical therapists, we will likely be dealing with people who are from 1 out of 10 pain scale all the way up to 10 out of 10 pain scale. So it's our job to be super empathetic and super compassionate and being able to help those people improve.
So you may be wondering what the difference is between a physical therapist and a physical therapist assistant. So we'll go over that super briefly right now. So basically what it is just time that you're investing in your education. So for DPT programs, you're looking about 3 years. Some programs are accelerated where they're 2.5, but you're really moving fast. So if that's something that you're interested in, absolutely. With that, you're going to cover far more information. You're going to have much longer clinical rotations, and you will, by the end of your schooling, be able to evaluate, treat, and diagnose patients. Typically, the pay for the DPT is going to be more. I mean, you're investing more money into your education, so you should be getting a little bit more out of it. So basically, to go over everything that the PTA is, it's a little bit shorter. 2 years, I think, is the absolute max. You will be working under a licensed DPT, so you won't have the creative freedom to be able to directly evaluate patients and directly treat and diagnose them, but you will be working right alongside patients, and you will be allowed to make changes to their recovery and progress, but it will be under the advice of a DPT. So with that DPT degree, you have a little bit more freedom and a little more autonomy to make your own decisions, and then you get paid a little bit more.
Okay, so we're going to go over a few of the physical therapy specialties. So after you become a DPT, which, as we know, is a little bit of a long road. So after that, 3 years after you get board certified to be a general DPT, then you can, some people choose, some people don't, to go into a specialty. So as you can see up here, there are a bunch. We're going to break it all down. And if you guys have any, let me just throw this out there. If you guys have any questions about anything, you can go and throw a hand up. You can wait till the end. It's completely up to you. So if I know we have a lot of information to get through, so we're talking a little bit fast, but if you want us to repeat something, just let us know.
Also, just a quick question. How many of you guys knew about these specialties? How many of you knew that there was specialties for PT? Okay, perfect.
Yeah,
Awesome.
good
Good.
amount.
Okay,
I
cool.
did not.
I did not either.
For
I
a
really
long
didn't.
time.
So yeah,
Okay.
I love that.
So we're going to start with the orthopedic specialty. So this is the most common specialty to get. As you can see, in June 2024, there are 22,794 specialists. That is a number that's taken out of, there are over like 500,000 board certified physical therapists. So this is a very small percentage, but this is the biggest specialized, if that makes sense. So orthopedic specialists, they're trained to rehabilitate patients with multi-skeletal dysfunction. So basically all that ortho stuff, they just really hone in on it, and they're really good at what they do.
Perfect. Then the next most common one, which is significantly less common as orthopedic, is neurological. So it kind of is exactly what it sounds like. You're going to be treating patients who have neuromuscular system deficiencies or disorders. So some common ones include spinal cord injury, strokes, multiple sclerosis, Parkinson's, anything of that nature. And yeah, as of June of 2024, there are 4,965.
Okay, and then following neuro, which is a pretty close third to neuro, is geriatrics. So geriatrics is our senior population. They're usually 65 plus. Some clinics, they do bring in some people who are more like in their 40s, but it's usually 65 plus. And it's just like general, again, musculoskeletal issues, things like arthritis, osteoporosis, low back pain, things like that. These people are specialized in the older population. Yeah, and as of June 2024, there are 4,321 specialists. Just for those of you who came in, there are a couple seats over here if you want to squeeze in. If you want to hang out over there, totally fine too, but just letting you know.
I will also note too with geriatrics is that it's very common to do home health with a geriatric specialty, and home health does make a little bit more money than outpatient clinics do. So then moving on to sports, it's exactly what it sounds like. You will be trained to prevent, treat, and as well as educate athletes on injury. You know, there's really not much to it more than that, but you're just going to be focusing more so on the athletic population and correcting performance-related issues.
Okay, and then following sports is pediatrics. The shortened form is like peds. So this is for our 17 and under population. In some places it's 20 and under. It varies a little bit, but usually our younger crowd. So this is all the way from like birth, newborns, helping with like range of motion, helping with flexibility, strength, pediatric PTs, to my knowledge, do work more in hand with like OTs and which is occupational therapists and speech language pathologists for more of like the growth pathways, because like there's a lot of neuro involved. Peds is it's heavy. Seeing the little ones going through those stuff, it's tough. But there are 2,909 specialists in it. So definitely a lot of help for the littles.
And then we also have women's health. This is helping mainly with women who are being treated for pre and postpartum experiences. It also is informally known as pelvic floor therapy, treats pelvic pain, which I know it's called women's health, but men can also undergo pelvic issues and pelvic pain. So again, it really is mostly geared towards our female population. However, it encompasses a lot of information in that general region of the body. Currently have less than 1,000 specialists in this area.
Yeah.
So
This is definitely a growing field. I'll also add in for the male side, it's a lot of work with like prostate issues and things like that. So it's uncomfortable for a lot of people for obvious reasons. But it is a growing field. So that number has definitely increased over the last couple of years.
sorry. And then we have cardiopulmonary. We have that is going to, again, it's kind of what it sounds like, going to be helping patients managing different lung and heart and lung conditions. Sorry, it's been a long day, guys. So yeah, anything that comes with heart and lung issues such as heart attacks, surgeries, respiratory issues, anything like that. As we know, being mobile and moving with these kinds of issues can be really, really difficult to achieve. And as we all should know by this point, exercise is medicine. So this is a group that really, really helps not necessarily people with, I guess, tangible physical injuries that you can see, but problems that are a little bit deeper inside.
All right, and then we also have clinical, I always struggle with this, electrophysiology. So they use electricity to monitor physiological responses for evaluation, treatment, and prevention of human dysfunction. So they use a lot more of like the equipment that if you guys haven't seen it already, that you'll probably see later in your pathways here in like the exercise physiology labs and things like that. So EMGs, nerve conduction studies, it's definitely a growing field. Don't quote me on this, but I believe it is pretty common for the older population. But if you have any issues, get in to see them now.
And then we also have oncology, again, very similar to what it sounds. It's helping rehab with people with cancer and other related diseases such as HIV. So again, with the cardiopulmonary, not necessarily maybe tangible visual injury, but problems that are going on inside as well. You know, if you guys don't know, undergoing chemo can be very, very detrimental to physical attributes. So being able to come back from that, this is where oncology PT comes into play.
Okay. We're almost to the end, I promise. There's a lot, I know. So we have wound management. So this is one of the smallest specialties. So there's only 31 specialists. I believe that's because the specialty just recently came out. So it's definitely new. But people who who have like deep integumentary wounds or like people burn patients or things like that, wound management PTs help them like regain function, regain movement. There's not that many of them out there, but it's probably super helpful for those patients.
Awesome. So that was where all of our very specific board certified specialties. You will get specifically certified in them. However, there are other special areas to look out for. How many of you guys have been in an aquatic therapy clinic before? Awesome. Very, very cool. Yes. So we have hydrotherapy. Very, very beneficial for people who maybe can't support their entire body weight on land, water helps to really help with that. We also have vestibular rehabilitation. That's going to help with balance. Kind of works alongside neuro, but a little bit more specific to the vestibular system. And then finally, we have hippotherapy. Does anyone know what hippotherapy is? And Dean, you can't cheat because I know you know what it is. Any guesses? No, okay. I have a little picture as a kind of guess. It's actually working with horses. So it's typically with younger patients who have cerebral palsy. They'll be put on horses, and with that passive motion, you get a lot of ranges of motion that you usually don't hit in a typical exercise room. So very niche, very specific form of PT. But if there's any way that you guys can find a way to volunteer with that, that will look phenomenal on your application. And then I also just wanted to add, I know I had a few people come up to us during a week of welcome interested in occupational therapy. I will say I looked into it, and we unfortunately don't have an occupational therapy club on campus. But what I will say is that PT and OT work pretty closely together in certain situations. So if you do want more information on that, by the way, this entire PowerPoint will be sent out to all of you guys. You can go ahead and click this link, and this is coming straight from our school's website, and they will explain to you all of the requirements and things necessary to get into OT school.
Okay, so we just went over, there was probably like 10 specialties or so. So I know you're probably thinking now, oh, I'm interested in that. I think that's probably where I'll end up being if I pursue this career. But as you'll kind of get to tell, and as I've learned myself through my own like volunteer and observational experiences, is the thing that you think you want to get into might not be the thing that you end up getting into. So we just really recommend, and a lot of people out there recommend, when you apply to DPT programs and when you're in the program, just be super open, just gaining as much knowledge as you can. Because like for me, for instance, I was gung ho, I'm like, I'm gonna do sports. Sports is me. I was an athlete. I wanted to be like sports physician. I was like, ew, med school. But now I'm like, peds is like really near and dear to my heart, maybe neuro, and like all those things are interconnected. So just definitely really have an open mind. And when it comes to getting into DPT school, you really want to keep all these specialties in mind when you're looking at places to volunteer at. So if you can find a place that's outpatient ortho, that's fantastic. Definitely a great place to start. But also look at, maybe there's an aquatic therapy place nearby, or, and by the way, I find these by Googling. Maybe there's an aquatic place nearby, maybe there's neuro, maybe there's peds. And so get into those little specialties. That way you can broaden your own knowledge as an applicant, but also for your future career, it's like, wow, PTs can do a lot. It's not just, you know, ortho.
Exactly. So then we just wanted to get into how exactly you become board certified. So typically what happens is you go through residency. It's very similar to med school, where I guess not as long though, hopefully. It's about usually a year, and it's similar in the sense that you're essentially just diving into that one specialty. When you join a residency program, it prepares you to take the board certified exam, and it helps you to qualify for that, because it's not like you can just walk into a room and say, I want to take this board exam. You have to qualify for it. The residency will help you to do so, but there's no guarantee that just because you did a residency, you'll pass the exam. So that is something to keep in mind as well. And then fellowships is something that goes even beyond residencies. If you really want to focus in on an area, it's super for people who are interested in like education and research. If you want to conduct your own research in certain areas, that's where fellowships come into play. But these are basically what happens after DPT school and after you decided what specialty you would be interested in. So then going a little bit more just into the pros and cons, I won't go through all of this because there's a lot, but basically with the pros of residencies and fellowships, because you're honing into certain areas, you will be connecting with medical professionals who are in those specific areas. And I'm sure, as you guys know, physical therapy is about your clientele, right? The more people you have, more likely the more you'll be working and the more money you'll make. So if you guys have a connection with a surgeon, he will just send all of his patients to you. So that's where those like really cool specialties come into play. And then you'll be able to work in a clinic that you have the most interest in. So there's that as well. Also could be very valuable based on your career goals. So if you, let's just say you want to be the PT of the Los Angeles Rams, they're probably going to want you to be board certified in sports before they hire you. So certain positions, the residency is, I'm not going to say it's required, but it's recommended. So it'll help in that sense. The cons, though, are that, you're spending more money on more school, you're doing more school. I don't know if that's something that we want to do. You'll be working overtime and not getting compensated as much because they consider you're learning the compensation. And like I mentioned before, once you qualified for the board certified exam, it doesn't essentially mean you're automatically going to pass. If you went through that entire residency and failed the test, good luck. Yeah, exactly. Like, unfortunately, that's a one major con of it. So it also doesn't necessarily mean better pay. Just because, let's just say you're working at a clinic and then you tell your clinic, oh, by the way, I want to go get a residency. You need to be paying me more when I come back. That's not necessarily going to happen. Going back with the whole, like, if you wanted to work with the LA Rams, I bet you they would pay you more, but that's a different position. So.
Okay, so just some of our final takeaways. We have kind of pointed out some of these before, but physical therapy it's just a really good field for if you want to help people. Like I said at the beginning, you're going to be dealing with a lot of people who are in various levels of pain, various issues that are going on. You're also going to be doing a little bit of free mental therapy while you're there. So it's when you're getting into this field, you just want to make sure that you yourself are very passionate about doing it because burnout is real, especially through school. I'm sure we feel it as undergrad students. It's only going to get worse when we go to grad school. So we just want to be prepared that like this is the career that we want to get into. And that's why those like volunteer experiences, observational hours are so important. Personally, like it solidified that this is what I want to do. But I know people who did it and they were like, ooh, yep, nope, not for me. And that's okay, right? So our job here is to give you guys as much information as we can, be a resource, and yeah, be able to make us all great PTs. When it comes to like the residencies and the fellowships, we just wanted to give you guys the information on that. Obviously, that's not something that any of us are applying for even the next 4 years. But you just want to know about those like long-term plans and be able to just have all the knowledge that you can.
And just to drive that last point home, one of the biggest, and we'll talk about this in an upcoming meeting about prerequisites for PT schools, we'll get more into the details. One of the biggest things that programs look at is not necessarily the number of hours you have, but the differences in those hours you have. Someone who has 1,000 hours in one clinic probably won't look as great as someone who has 204. And if you're getting all of that different experience, you're showing them that I'm not just locked into one area, that you're willing to take and absorb all the knowledge, because DPT school will cover all of those specialties at one point. And a very probably brief, again, like we said, residencies, you're honing in on it, but all of that will be mentioned at one point. So we do have to keep our mind open to everything.
I know we've been kind of talking a lot. Does anybody have any questions on anything, comments, anything? Yeah.
For the residency exams, do you get to retake them, or is that like vary depending on like the residency?
I'm sure you would be able to retake, but I'm sure there's a gap between the time that you would have to do so.
Yeah, I would, if you can retake the board exam for actual DPT programs, I'm assuming for residency, you'd be able to too. Okay.
Alrighty, cool. So that was basically the harsh lecture content of our meeting. Sorry, that's probably the most lecture heavy this club will ever be. But we just wanted to make sure that we all are aware of all of the different specialties, but I'm glad that you guys already knew about a lot of them. So awesome. If you guys already have filled this out, great. If not, it's okay. We just opened it a few days ago, but this is our mentor-mentee program. Some of you might have talked to you about it before. Basically what we'll do is we will set you up as a mentee, as someone that needs the help, with any one of us or any previous board members or members of the club in the past that have the information and would be willing to meet with you one-on-one to discuss anything as far as understanding what PT is. One thing that a lot of people really get out of this program specifically is like planning classes, because prerequisites in our undergrad go towards PT school prerequisites. If you need help with GRE prep or really any question that you don't, I guess, feel comfortable like emailing one of us and you don't know where it's going to, this person will really be your connection for at least a semester, if not the whole year.
And then our mentors, if you have been in the club before, like I said, there are a few of us who are alumni of the club, so to speak, that have already volunteered their time for this. But if you want to apply, you just have to at least be in your second undergrad year. Basically just have a little bit knowledge. Sorry, freshmen, if you're in here, you are a great candidate for a mentee. Next year, we'd love to have you as a mentor.
Yep.
So yeah, if you're interested, there is a sign up in the link tree. You can also probably just come tell one of us and we'll guide you to it.
It's there. Yeah, here we
Yep.
go.
Oh, there
Yeah.
we go.
So, like I said, that QR code is gonna be popping up a lot, but the mentor mentee application should be the fourth link down if that's something that you guys are interested in. I will say by the time this meeting ends, that first link will disappear because I'm not gonna need you guys to check in after the meeting, so it will become the third, but it entails it on our link tree. And we have the deadline set for October 31st. It's not like a harsh deadline. If you turn it in after that, I'm not gonna be like, no, like we're not gonna pair you. But you know, the earlier we can do it, the quicker we can pair you. The earlier we get your guys' applications, the quicker that people can prepare to
Yes.
help you. So the sooner the better, essentially.
Right. Any questions on the mentor mentee program at the moment? You can always ask us at any time. Okay, perfect.
Perfect. And then we have our new member form. I have a feeling most of you guys have filled it out at this point. If you haven't yet, by no means, it's not required, but it really, really helps us to get to know you better and get to know what you want to get out of this club. Also, if you fill out this form, then we will put you on our email list. So, I mean, again, it's not required, but I personally would. Please, please.
Yeah,
Mhm.
sign up.
That should be the third link. Again, it's outlined on our link tree. And then, yeah, our next meeting is going to be a Q&A session with a current practicing DPT. Maureen, do you want to like share a little bit about her?
Yeah, so she's a PT, she has her OCS residency, so the orthopedic residency we were talking about earlier. She's also a professor at USC. And she's gonna kind of talk a little bit about the program at USC, the application process there, and she's also gonna bring in a case study. So explaining a list of symptoms, and we're gonna kind of get to discuss it and do the diagnosis together, so should be really fun.
And ideally, I mean, we have it planned to be in 2 weeks in the same room, but I think we outgrew this room. So we're gonna see if we can get a little bit of bigger one. Currently, this is where we're at. So if you know if that is what happens to happen, it will. But if we change anything, we'll post it on our Instagram.
Yes.
And then probably what more than half of you have been waiting for. Here are the volunteer opportunities that we promised. So again, like I said, we will be sharing this out with all of you guys so that you can click on those in text links. But we have a few volunteer opportunities. So Lily knows Costa Mesa Physical Therapy.
Yes, so at Costa Mesa PT, that was where I had my first experience. That was where I had my first experience. I worked there for over a year as an aide. Unfortunately, it's just a little far for me, but if you live in like the Huntington Beach area, it's right in like Costa Mesa. So it's a great clinic. The owners, they were professors at Chapman University. They're also a teaching clinic, so there's a lot of like student PTs that come. I don't think that they're hiring for aides right now, but they are always open for volunteering. So you can go ahead and email them. They can set up something that works with your schedule. They have various hours. So yeah, super like close-knit community family type clinic, like I'm sure a lot of the clinics around here are. But yeah, go ahead and reach out. Worst case scenario is it doesn't work out. So that's the best. That's honestly for all of these opportunities that we're going to be sharing with you guys throughout the semester. The worst thing that happens is it doesn't work out, right? I've emailed so many places that never even responded. Currently still emailing places that don't respond. So don't get discouraged. These places should respond, but just throwing that out there.
Yeah, so I don't know if you guys have also seen there is Select Physical Therapy. There's one literally right down the street, but they're very, very common in this area. So that is one. They are absolutely, like, I want to say 100% of the time open to volunteers. So they will accept you in. And we also have like closer contacts if you guys are super interested in that one. And then these are both inpatient opportunities. So this is a little asterisk, like we were saying, we want to open it up to all of the different experiences. Inpatient hours look phenomenal on your application. They look really great because working in a hospital can be a little scary. So, but don't get discouraged by it. They're going to ease you in and it's going to be great, but that's why it looks so good on an application. So Memorial Care, again, should be like right down the street. They have an application process. Again, when I send this out, it's linked right there in the picture above. But if you don't want to go through that, you can just look up Memorial Care Volunteer and they will walk you through the application process and what it looks like to apply as a volunteer. And then Tanzi, our VP, sent out our PAH Health. They have multiple locations. The two that she said that to focus on are Whittier and Downey, just because they're opening their application soon and to college students. So That application opens on October 23rd at 3:30 p.m. The link is also in that picture above. Again, if you don't want to use the link, PIH Health Volunteer Opportunities, it'll pop up right away.
Okay. And then these are some of current paid PT aid positions available. You don't need any current experience. They will teach you everything on the job. So highly recommend. This is probably your applicant pool. So look around, find it out. No, I'm just kidding. But so Harbor Physical Therapy, that is where our speaker for the next time is coming from. So I'm sure she'll also put her clinic on blast. And then hands-on rehab and aquatics.
I literally work there like right now. So we are hiring. So if you guys want to apply, just send an email with your availability and your resume. I literally just came from there like 5 minutes ago.
This is Alvin, by the way, our
Hi, guys.
community outreach. Alrighty, perfect. And that should be all. For everyone, I just want to quickly mention before I let you guys go. For everyone who's in the Discord
I'm
with
so
all of the bots. Yeah,
Sorry.
yeah, they're really annoying. And I have no idea. I don't know who owns it, so I was not able to contact them and figure it out. So we made a new one because they were actually getting so ridiculous. So yeah, that's the QR code for that. There's also our app for that. So feel free to join that one instead.
Please do. Actually.
And go ahead
I've
and ditch that other one, please.
Just leave it. Just
Oh
leave
my
it.
gosh.
And whoever was trying to actually sell their Mac, I'm sorry. People probably thought you were a bot too.
And yeah, so yeah. And then for everyone who did not get the chance to check in, we had this link at the very beginning. If you don't mind doing that, it's just so that we can get an attendance count.
And then, like we said, for the next meeting, we will post all the information up. It is looking to be about 2 weeks on Thursday, 5 p.m. same time. We will be looking to get a bigger room.
Yes, yeah.
Thank you everyone for showing up, showing out. We appreciate it.
Yeah.
Any questions? Comments, concerns?
Who thinks they're gonna come to the next meeting? Yeah. Oh my gosh, we love that. Okay. Well, we are all set. If you guys are good, if no other questions, you can come up and ask us questions. We'll be here until 7 at least. So yeah, if you have anything specific, feel free to come on up. And if not, have a great rest of your day. Thank you guys for
Thanks
coming.
Hi. Hello. Nice to meet you. Okay, I'm gonna go stand down.
Some clarification, like.
Thank you guys for
residency
coming.
scholarship flew like right over my head.
Lewis, to answer your question, yes, we will be sending out a recording. We'll be posting it on our YouTube, which is also in our live stream. We'll do that as soon as we get out of this meeting.
So.
And then the next meeting for Celine, yes, we will be doing the same thing where we'll have it both in person and on Zoom. And then, yeah, that's pretty much it. But we'll make sure we get those recordings out to you. Oh, you know what? I'm not gonna tell you not to. Please go ahead and apply, and we will try to hook up the best situation that we can with you, Lewis. Unfortunately, like we said, all of us are more so pros on the PT program, but we can figure it out for you. We can find someone that will help. Thank you guys so much for coming. Thank you for adjusting your schedules.
Thank you, everyone.
Thank you.
No, she's gonna like describe a